Nurse practitioners, also known as registered nurses in the extended class, have met additional education, experience, and exam requirements set by the College of Nurses of Ontario. They are authorized to diagnose, order and interpret diagnostic tests, and prescribe medication and other treatment. The nurse practitioner role was established in 1997 in Ontario to improve health equity and increase health access. While Ontario has approximately 3,500 nurse practitioners practicing in all sectors of the health system, including the province's 26 nurse practitioner-led clinics, Ontarians continue to struggle with access to healthcare. Further, as exposed by the COVID-19 pandemic, health inequity persists in Ontario as a result of social and economic policy choices made by successive governments. RNAO's leadership and unwavering advocacy for NPs throughout the decades has positively influenced the role.
Nurse practitioners are an essential part of the healthcare system to help our patients both in hospitals as well as in the community.
Being a nurse practitioner positions yourself in a brilliant way where being a nurse as a background allows you to understand the holistic concept of health, that is environment, and the social determinants of health that is important to provide the best quality care in order to deliver to your patients across the lifespan.
For a few years, I had tried to be rid of a parasitical infection by various antibiotics to no avail. It was not until I transferred doctors and received care from a nurse practitioner who investigated further into the situation that I was actually able to be rid of the infection after 4 years and several trials. I was very grateful that the nurse practitioner was willing to press further and investigate and help me in my situation.
I really value the nursing approach to client care. And becoming a nurse practitioner allowed me to bring that level of care to the broadest portion of client care that I could. It's a very challenging role. It's a very difficult job, but I find it very rewarding, and I'm really glad to be able to do it.
Nurse practitioners continue to advance the goals of the quadruple aim by 1, improving the care experience, 2, realizing quality health outcomes for clients across all settings, 3, improving positive NP provider experiences, and 4, demonstrating the cost-effectiveness of NPs when comparing NPs to family physicians. In RNAO's NP Task Force report, Vision for Tomorrow, NPs are positioned as global leaders of a new wave in healthcare that embraces the United Nations Sustainable Development Goals and aims to advance an inclusive, equitable health and social system that leaves no one behind. Unfortunately, in Ontario, the number of NPs overall remains extremely low when compared to the US, with approximately 63.7 working NPs per 100,000 people. The number of NPs per 100,000 people in Canada is 16, and 23.4 NPs per 100,000 people in Ontario. The US ratio is more than 4 times that of Canada and almost 3 times that of Ontario. To achieve the objective of an integrated, accessible, and equitable health system in Ontario, much more must be done to expand the number, role, and scope of NPs. RNAO calls on the Ontario government to develop a comprehensive health human resource HHR plan, optimize the utilization of NPs within current scope of practice, expand the scope of practice for nurse practitioners, align NP curriculum with expanding scope of practice, harmonize nurse practitioner compensation upward across all sectors and settings, invest in research to support NP practice, and optimize access and continuity of care.
For me, I find that nurse practitioners, especially out in the community, they're an integral part of our society just because there's a clear burden on our healthcare system, and I think practicing NPs are people who lessen that healthcare burden, especially with the burden on acute care. I think community care, if we empower those individuals in the community and take care of them there, we'll have a lessening of a burden on the hospitals too, which is currently immense.
I guess the first time that I had an encounter with a nurse practitioner was at my own doctor's office. He was away on vacation and she was filling in for him. I had gone in for a minor thing, and so I was like, okay, there's always that comfort of having your own doctor. But you know what? She changed that instantly. She was so incredibly thorough, and she actually spent the time with me to talk about my history and talk about even my family, and the personal touch was just so incredible. I have to say that my experience with nurse practitioners has been nothing but positive.
I like to share some of the reasons for why I entered into the nurse practitioner program. So I've been a registered nurse on the front lines for just over 3 years, and most of that experience has taken place during the pandemic. The pandemic has really enabled me to take stock of my experiences and recognize some of the gaps that exist within the healthcare system, many of which have only been exacerbated by this pandemic. So I firmly believe that primary health care without barriers is vital to promoting the health of communities. So with continued commitment to funding of more nurse practitioner positions, I envision being part of a healthcare system where primary health care, disease prevention, and health promotion are easily accessed, and that I can, as a future nurse practitioner, help contribute to those patient outcomes.
It is essential that the supply of NPs continues to increase across all sectors and settings, that NPs are better utilized and optimized within their current scope, and that the scope of NPs continues to expand.